Nitroglycerin, or nitro, is a potent vasodilator. It helps dilate the coronary arteries that supply the heart muscle with blood, thereby relieving the chest pain associated with angina. In many cases, the patient has been advised by his or her physician to take nitro whenever they experience chest pain. First responders commonly arrive on the scene to find that a cardiac patient has already taken nitro. In other cases, the patient may have the medication but not yet thought of using it. Assisting the patient with the nitro may reduce myocardial damage. To assist a patient with nitro, all the following indications must be met. The patient complains of chest pain. The patient has a history of cardiac problems. The patient's physician has prescribed nitro. The patient has the medication with him or her. The patient's systolic blood pressure is greater than 100 systolic. Medical direction, a standing medical order, or local protocol allows you to assist the patient with nitro. Contraindications for the use of nitro include: the patient's systolic blood pressure is less than 100 systolic. The patient has already taken the maximum prescribed dosage. The patient is unable to open his or her mouth. The patient has taken Viagra within the last 6 hours. The patient has a head injury. The patient is an infant, child, or falls below an age limit set by local protocols. Presence of significant trauma. Nitroglycerin is normally absorbed within 1 to 2 minutes, with a duration of between 20 to 30 minutes. Possible side effects include hypotension, headache, changes in pulse rate. To administer nitroglycerin, you will need the following equipment: blood pressure cuff, patient's nitroglycerin tablets or nitroglycerin spray, stethoscope. Complete an initial assessment. Administer high-concentration oxygen by non-rebreather mask and perform the focused history and physical exam prior to administering nitroglycerin to the patient. Make sure the patient meets all the indications for use of nitro and exhibits none of the contraindications. Be sure to take a full set of vital signs, including blood pressure, prior to administration. Vital signs should be retaken every 5 minutes, and the patient should be constantly monitored for changes. Remember that there is always the possibility of the medication causing a hypotensive event. Take BSI precautions. Be sure to wear gloves at all times. A nitroglycerin pill can be absorbed into your skin, if held long enough. Consult with medical direction and/or review any standing medical orders or protocols related to the administration of nitroglycerin. Check the medication for its expiration date and ask the patient when the container was first opened. Inquire about how the medication has been stored. Nitroglycerin is light, heat, and age sensitive. Find out when the patient last took nitro. Ask the patient how he or she has reacted to the medication in the past. The patient may have similar reactions this time. Check the 5 rights of drug administration. Do I have the right patient, the right drug, the right dose, the right route of administration, and the right time? Place the patient in a comfortable position, preferably one that will allow you to move the patient into a supine position if necessary. If the patient's nitro comes in tablet form, take these steps. Remove the oxygen mask. Ask the patient to open the mouth and lift the tongue. Tell the patient not to swallow the pill. The nitro should dissolve under the tongue, where the medication will be quickly absorbed. Place the tablet under the patient's tongue. Replace the oxygen mask. If the patient's nitro comes in the form of a spray, take these steps. Do not shake the canister. Ask the patient to open the mouth. Spray the medication according to the directions on the label. Ask the patient to wait at least 10 seconds before swallowing. Replace the oxygen mask. Retake the patient's blood pressure within 2 minutes. If chest pain persists more than 5 minutes, consult with medical direction and/or refer to standing medical orders or local protocols. In some EMS systems, multiple doses of nitroglycerin can be administered. Document findings. Retake vital signs every 5 minutes for critical patients and every 15 minutes for stable patients. Ask the patient about the effect of the medication on pain relief. Constantly monitor for changes. The most significant problem associated with nitroglycerin is the possibility of causing a hypotensive event. Usually, you can relieve the condition by placing the patient in a supine position and raising the legs slightly. First-time users of nitroglycerin, or patients who drank alcohol or who are taking antihypertensive drugs, can compound the side effects of hypotensive events. Drugs used to treat impotence, such as Viagra, Levitra, and Cialis, may exaggerate the blood pressure lowering effects of nitroglycerin. About 50% of patients taking nitroglycerin complain of associated headaches. If a patient does not have their prescription of nitroglycerin, provide immediate transport or request for ACLS backup.